Hello everyone, and welcome to our webinar. It's great to be able to host the webinar today. So for those of you that don't know me, my name's Russell Lamb. I'm the Managing Director of DMA Engineers here in Brisbane, and we're a building services consulting practice that does a fair amount of work in healthcare. So I suppose what's brought about the webinar is we've seen this as a great opportunity to join on the back of Healthcare Week, which is currently taking place in Brisbane, and most notably there's a conference today and tomorrow. But as we know, not everybody can make it along to a function of that nature for various reasons. So we thought it would be really opportune to put a webinar on, and as part of that, provide some insight into the latest design thinking of healthcare. So specifically today, we want to provide some insight into designing for a wellbeing project, which is linked between the University of Melbourne and the Australian Research Council. And this has caused us to reach out to Dr Stephanie Liddicoat, and we've asked her if she'd be happy to share some insights with us today, and she's gracefully accepted that, and we're very excited about the content of the webinar. So before I introduce Stephanie to you and then provide an outline of how the webinar will run, I would like to provide an outline, I should say. There's a Q&A panel on your webinar interface, so please feel free as Stephanie is working her way through to type in and post your questions there. Stephanie's presentation is principally broken down to 4 sections, and if things go to plan, we'll break at the end of each of those 4 sections and to go into a bit of a Q&A session to keep it a bit relevant. So I think that's pretty much all of the housekeeping to do with the webinar. So now, I would very much like to introduce Stephanie to you. So Dr. Liddicoat is one of the world's leading researchers in architectural design and health, with a concern for the psychology and wellbeing aspects of design practice. She's engaged as a research fellow on the ARC linkage project, Designing for Wellbeing, realising the benefits for patients through best practice hospital design, through the Faculty of Architecture, Building and Planning at the University of Melbourne. It's very impressive, and if that in itself is not enough, Stephanie has over 30 publications in the area of designing for health and wellbeing, including winning Best Design Research Paper at the European Health Design Conference in London in 2018. So certainly sounds like a fairly prestigious award, so well done with that. So without further ado, I'd like to now hand over to Stephanie to outline a presentation and to get underway with it. Thanks.
Well, thank you for that wonderful introduction, and welcome to everyone this morning. Thank you for making the time to have to attend this webinar and for this discussion. So what I'll do is I'll share my slides with you. As mentioned, we will have a few breaks through this, so I'm happy to take questions and to have a bit of a dialogue and discussion as we go through this morning. Now, what I need perhaps you to do, Russell, is I think you're sharing your screen and I can't share mine whilst yours is shared. So,
okay, bear with me.
Yep, not a rush.
How do I do that? Sorry, bear with me. Sorry, Stephanie, just having a slight technical hiccup there.
That's all right. Right, well, perhaps while you're doing that, I can introduce a little bit about the study that I'm engaged in as a research fellow. So this was conducted in partnership between the University of Melbourne, the Faculty of Architecture, Building and Planning, and Lyons Architecture, who are a very well-known architecture firm based here in Melbourne. So I'll just share my slides with you now. Here we are. So here we go. So what I want to cover first is some of the research methods that we used in this study. Now, it's really important, I think, when we're examining research in the evidence-based design field to think very carefully about how we're conducting that research to make sure that our findings are rigorous and reliable. Now, obviously, we can't replicate the gold standard control study in architecture. You know, our experience of architectural space is very complex, and we can't perhaps draw conclusions between a particular kind of experience and one architectural feature, because there are many aspects of that environment that might influence our experience. Now, we know that there's a lot of research that suggests that the environments of healthcare facilities directly affect the well-being of patients, staff, and also the families. And certainly, poorly designed environments exacerbate patient anxiety and stress and really diminishes their healthcare experience. So we were really interested in what aspects of the architectural environment are contributing positively to well-being, comparatively, which ones are more important or have greater effect, and what does this mean for the design of future healthcare facilities? So we did this through quite a comprehensive comparative case study analysis of new Australian paediatric hospitals. Now, as I was mentioning, the challenge here is that the effect of architecture is very hard to measure. There's certainly not one way of describing an architectural design feature. In fact, everyone perceives them really quite differently. Architectural features impact users in different ways and for different reasons. So how I feel in a space might be determined by the materials that are in that space, the quality of the light, the furniture, the style of the furniture, who else is there, what culture I am from, what I had for breakfast that morning. You know, it's very, very complex. And so we need to be cognizant of that when we're doing research in this sector. There's also often a gap between actions and words. So people sometimes say one thing about a space and yet they do another. So we need to be aware of that when we're doing this research. And we often need quite large sample sizes in order to produce a reproducible result. So particularly in our study, we were looking at paediatric hospitals. So they say never work with children and animals. Well, we did a lot of work here with children, and had to think very carefully about how to understand the children's needs and perceptions of that environment. So being aware that the patients range from newborn through to 18 years of age. Some patients cannot communicate as easily as others, and yet all of their views are important, and certainly quite robust ethics permissions are required to work with children. So what did we do? Well, this is a fairly extensive study. We had both qualitative and quantitative methods. So we had a series of different surveys that we rolled out, different ones for patients, for caregivers, and for staff. We did some drawing exercises with the children, and I'll come to those a little bit later on. We conducted some photo response interviews. Now, this was mostly with inpatient children. So what we did is we showed them photographs of different hospital environments and asked them to give us their thoughts and opinions on those photographs. We did some observations. We looked at how people move and act and interact and behave in different hospital spaces. And we also did focus groups with patients, caregivers, and staff. So the idea here was to triangulate findings across multiple methods. So we weren't just relying on one data collection type, but we were validating it through these independent data collection methods. So here you see what our surveys looked like. So we had paper-based surveys and slightly different ones depending on who we were asking, if we were talking to patients, staff, or caregivers. And then we did what I mentioned before. So this is the drawing exercises that we conducted with the children. So in this particular one, we asked the children to draw a storyboard describing their journey through the hospital that day. This enabled us to collect children's experiences of the hospital environment. What was memorable? What was standing out for them? And then as they were drawing, we were talking to them and asking them about why that was important. Why was that memorable? Sometimes it was for positive reasons and sometimes not so positive reasons. And this enabled us to really gather those thoughts and ideas from those children and young people. Now, we also did another exercise where we asked the children to draw and imagine their dream hospital. What might that look like? Now, the idea here is that it was quite aspirational. So we start to understand what the children are perceiving as missing from the paediatric hospital environment. What would they really like in this environment? And what are their understanding of the needs, not just of themselves, but also sometimes of the staff, the work that's being done, or their families. So for many children, they drew areas for parents to get a coffee or to occupy themselves in some way. Where would dad like to spend some time while he's a little bit stressed, perhaps? And so these were lovely initiatives that we could see the children were thinking about that weren't being provided in the hospital at that point. So across all of that, particularly at the Royal Children's Hospital, we collected 291 surveys, did 32 photo response interviews, 10 hours of focus groups, and 182 hours of spatial observations. So certainly a very extensive study that was conducted. Now, what did we look for? Well, we looked for strong data trends at each site. So like I was saying, that similarity in findings between one research method and another. We were looking for those correlations across the data. And then we focused on key elements and findings and brought those together, which I'll discuss in the next few sections of this webinar. So perhaps now is a good time to pause and take some questions on any of the aspects that I've covered so far on our research methods.
So Stephanie, at this stage, we don't actually have any questions on your research method. So I know from my perspective, yeah, got a great understanding of how you've gone about it. So I think we're good to go into your next section if we could.
Absolutely. All right. So I'll carry on then. So firstly, from our research findings, first I'll talk about one of the really key themes that we had emerging. And this was this notion of reframing expectations. And really this is about the role of distraction in the paediatric hospital. So what do I mean by that? Well, in line with best practice in the design of these paediatric healthcare facilities, the hospital sites that we spent a lot of time at, particularly the Royal Children's Hospital and Monash Children's Hospital, they offer multiple distractions to patients. These include things like playgrounds and gardens. We have interactive screens, often in the public areas of the hospitals. We have a full-scale movie theatre, what's known as a Starlight Express room. So this is a children's activity room, a play space, a safe children-only play space. Monash Hospital has a bring your own pet to hospital enclosure, so you can bring along up to a horse if you have a horse and you're a child in hospital. We have a zoo enclosure featuring meerkats at the Royal Children's Hospital, and also a large double height aquarium. So these are really quite wonderful features that really capture the imagination of the children. So I've got some examples here. This is one of the meerkats from the Royal Children's Hospital, which is a very, very popular attraction of the hospital. And here we're seeing some interactive sculptures you see here on the left at Monash Children's Hospital, and an interactive gaming screen that we see in the atrium there. And these are wonderful for providing a level of distraction. But beyond that, it's about reframing the expectation of what a children's hospital is. So our study found that the children often don't spend a long time at these attractions, particularly in relation to the meerkats. Often a very, very short window of time was spent looking at the meerkats. But the amount of time that the meerkats came up in conversations, in the focus groups, in the surveys, in the children's drawings of the hospital showed that it was incredibly meaningful, that it was telling the children that the hospital is a fun, exciting place. It's full of lots of things to do and places to meet other children. And it wasn't just about illness and being unwell and being, the nervousness that goes with treatment. So these kinds of distractions are valuable in the sense that they get children a bit excited about what's going to be happening. And this is a real significant departure from the idea of a hospital as a clinical space. And this is really important for the children and their experience. So it also extends to things like sculptures, which again are quite common in these hospital atrium type spaces, which are incredibly memorable. And again, for the children, represent a place where they can meet other children and socialise. Which is something that is reframing that expectation of the paediatric care environment. Some examples, this is from our surveys. And it said, what is your least favourite place within the hospital and why? All of it, other than the meerkats. So we get a sense of how important those meerkats are. I hate hospitals, I don't need to be here, but I really love the meerkats. The meerkats are fun, they're living and distracting. So we get to understand the value that these distractions are bringing to that care environment. Now, our survey also asked respondents what aspects of the hospital were taking their mind off being in hospital. And we see one of the most significant is this last bar here, animal attractions. So that's the meerkats, that's the aquarium. Over 50% were selecting that these were important, and they could indeed take your mind off being in hospital. So we start to understand the value there that these kinds of attractions have. And one patient explains about the aquarium, I've always liked fishing and all that at home, and it's nice to see something that you sort of recognise, and you have fish that you recognise back home. These elements are giving a sense of normality to the hospital environment, making it less alien, less intimidating, and therefore more welcoming for the children and young people. And certainly, as we witnessed, one child walked in to the meerkat area, sighed and said, "It's nice to be back." And we think that that is a really wonderful approach that any hospital would love to evoke, this kind of idea that actually it's a nice thing to come back, and that there's lots here that's exciting and attractive and fun things to do. So perhaps now we might have a few more questions. Happy to take some questions.
So Stephanie, we have one question. Before we get into that, I can just see how you've made some wonderful insights into moving away from that really sterile clinical environment that hospitals can be, and somewhat of a daunting space, to something that, as you say, is a relaxed and exciting space, and just bringing normality back into it. So it must add an awful lot to just well-being while kids are in hospital, and not only kids but parents as well.
Absolutely.
Yeah. So we've got a question in from Donovan Ferguson, I should say, and Donovan's question is noting that there's a strong focus on paediatric hospitals in the webinar, but wondering whether you can actually give an insight into the wellbeing design features or some research for inpatients within a mental health ward, whether that be paediatric or otherwise?
No, that's a really wonderful question. Donovan, my area outside of this particular study, my specialty is design of mental and behavioural health environments. So certainly it's an area close to my heart. It really depends on the acuity as to the strategies that you might use within an inpatient care environment. I would say it's often about achieving that right level of abstraction and then looking at the design strategies that are the most helpful to facilitate that. So within mental health, there's often a tension between providing safety and security on the one hand, but also empowerment and individual determination and choice and agency in the other. And these are often quite conflicting. So for me, architecture is about how can we ensure that service user feels empowered, that they feel welcome and at home, that they have a level of choice, that they can personalize an environment and feel at home and feel safe, whilst making sure that we align with that duty of care and that their safety and the safety of those around them is also a priority. So that feeds down to design strategies whereby we might promote choice wherever possible, even something as simple as dimmable lighting, being able to pull your curtains, adjust your own privacy is quite important. Being able to personalise an inpatient bedroom in a particular way is really important. Making it feel less clinical. So that's often through things like soft furnishings that will make a space feel like there is a level of care that has been taken, that that person is important and that their mental health is important. And these go a long way to reducing the stigma that's often experienced by these service users, and supporting them in their journey towards recovery. But I could do a whole nother webinar on this topic.
It sounds as though that could be beneficial to the group. We've got one more quick question there, Stephanie, and Dongze has asked whether there's been any traceable difference relating to gender or cultural backgrounds in your findings.
Great question. Look, the gender and cultural aspects didn't come up a whole lot in our particular study. It does actually more so in the mental health sphere, mostly in relation to cultural norms. But what we did find is some of the on the ward, some of the needs of the families would vary a little bit. So for some, having access to a prayer room to pray multiple times through the day, if that was a really long distance from the ward, that's potentially problematic. Being able to share a meal together was really important for some families. So I'll get to that a little bit later in the webinar, but having spaces that allow a family to share a meal and to observe some of those routines of daily life within the hospital environment makes that whole experience feel less alien and gives them an opportunity to reconnect in a way that they would do at home. So that's not necessarily culture per se, as just different ways of family being and experiencing and traditions. And wherever possible, being able to afford those opportunities will enhance the resilience and the experiences of that family.
Yeah, so we've just got, well, thank you very much for that response. We've just got another quick question come in from Mark Winter. So Mark's question is, do you look just at the overall feel of the facilities, or do you also study the security within these facilities?
That's a great question. For me, they are considered as one and the same. They're two sides of the same coin. So it's about how can we make a space that feels safe, both physically and psychologically, and then what are the materials by which we might afford that, and how are we laying out a space so that there is a level of perhaps a visual surveillance, yet people are also feeling that there's a level of privacy. So we certainly look at all of these in our research.
Okay, thank you for that response, Stephanie. So that's great, everybody, for putting in your questions. You just encourage everybody to keep doing that. That probably closes out our questions for that part of Stephanie's presentation. So I'll hand back to Stephanie to continue with the presentation. Thanks, Stephanie.
Thank you. Okay, so the next area of findings that I wanted to cover is on the social spaces for parents. Now, we certainly found that these social spaces were incredibly valuable for parents and families with unwell children who were really living on the ward, sometimes for, you know, weeks at a time. And so their lives are incredibly different in this inpatient environment. So how can we make them the most supported? So it's not, we have to remember that the paediatric hospital environment is not just about the children. The family well-being impacts the child's ability to recover from surgeries, for example, to be more resilient, to access emotional support. And if parents are stretched beyond their own capacities, it's very hard to support their child in that moment. So considering broadly the patient as well as the family is really important in this setting. So staff commented that it was incredibly important to have a non-clinical area within the hospital for parents to have a sense of a normal life within the chaos that's going on in their world. For me, this really sums up the need for these kinds of spaces. A parent said that it was important to have time away and to normalize things. Parents are probably feeling tired and run down and hungry as well. So I think helping them feel a bit better and calmer will help them to be with their child. So here it really illustrates why these kinds of parent support spaces are really important. We also noticed that in some of the parent lounges, so these are often provided on the wards, for parent lounges, parents and carers were observed talking with others more in these environments than many of the other sites that we looked at. So here we're comparing one of the parent lounges to an emergency department waiting area and the ground floor family hub. So this was a sort of a mixed inpatient and outpatient social area. And so we see a huge disparity in how much parents are talking with others across these different sites, telling us that there's a lot of interaction that happens between parents and carers in parent lounges. So we looked at a couple of different parent lounges, which I'll illustrate here. So this is one parent lounge A. You can see that it's quite small in plan, only seating really for 5 comfortably. Small little kitchenette to make a hot drink, maybe heat up some food in a microwave. So really quite a small, oddly shaped little space. Now what we see here is predominantly parents coming in preparing food or drink and really doing very little else. So they're not tending to family in there, they're not playing or sitting in there, they're not talking with others. Typically they were in and out in 30 seconds or less in this particular parent lounge. Now one of the others that we looked at, which we see here on the screen, much larger parent space. We can see multiple seats. There was an outdoor area as well, quite a substantial kitchen area with a kitchen island and seats where you could sit at the island, talk to someone who was preparing something in the kitchen, and a reasonably sized communal dining table as well. And on the south side, there was also, the whole facade was glazed with views out and lots of natural light in this particular parent lounge. Now in this one we see such a huge difference. So lots of parents observed talking with others and talking with family. Huge difference compared to the other parent lounge. So there was a lot more cross-family interaction happening in this very differently designed space. So our observations showed that 54% of parents were preparing a meal in the second parent lounge, and compared to, say, 31% of parents in some of the other lounges that were there. So the facilities to be able to actually prepare a family meal was something that was really important and was being used a lot, those facilities. In relation to these kinds of parent lounges, the parents talked a lot about them in our interviews. So one explained that you get great advice from other people, those families on the wards. You get to know them and know the families and their stories. And for them, this was really valuable. They felt that there were other families going through a similar experience, and that they were able to connect with those families, sometimes to give them advice, which was really empowering in a world where much of their experience was quite disempowering. And that was a really valuable aspect of a parent lounge. There was also a lot of social support. As one parent explained, I was talking with a mum yesterday, for example, and her child's waiting for an organs transplant, and he's a very sick little child. And all that crisis with the doctors coming around and everything else, but you still manage to talk about going away camping and different people's methods of dealing with the laundry in the shared facility. And some people fold their washing and put it in a pile. Very humdrum things that in a way don't mean anything, but in a way probably mean a lot. And that's the lovely aspects of experience that are provided by a parent lounge, a sense of normality and a way to connect in with other families and to have an experience that is not about clinical treatment, but is about the normal life that occurs outside of the hospital. And so that level of social support was really important for those parents. So in terms of how to actually design a supportive parent lounge, our study uncovered a series of design suggestions that any of our participants here might find useful. So certainly ensuring that the parent lounge is within the ward itself, so not a really long way from where the families and the patient is based, because the parents don't want to move too far from their child, so they will not use it if it is too far away. Ensuring that seating is provided so that it's comfortable, but also might allow for sleeping. We did see parents sleeping in the parent lounges often for quite a number of hours. So, there's a very sleep deprived, very stressed parent that sometimes need a place to sleep. Including dining tables and chairs for eating a meal that's large enough for multiple sets of parents and families, that will promote that interaction, that collaboration, that discussion, that social support. Certainly inclusion of artwork was found to be really beneficial, and the abstract and the colourful artwork was more preferred. In terms of the equipment, including at least 2 microwaves for peak use times, including a fridge, facilities to make tea and coffee, a cooktop and an oven to be able to prepare a meal from scratch. That was really important. Many parents also talked about the cleanliness of these areas though as well, so making sure that they are clean and easy to maintain. Making them seem the most comfortable, so minimising those clinical references and the material colours and choices was considered more beneficial. Having a space that was quiet, especially as on the ward can be quite noisy, so that was important. And being able to divide the space into smaller zones, so perhaps the way that it's laid out with the furniture and movable items allows parents to mediate their own interactions in privacy if they are just needing a moment to themselves or just a break from their child's inpatient bedroom, but don't really want to be engaging with others for a moment. Also including a little play area for parents who have other children who are not inpatients. So for many parents, they were there with other siblings, their child's siblings that were quite well and quite bored often, and they needed a space to be entertained and to play whilst still being supervised by that parent. So perhaps this falls as another point for us to take a break, and any questions that might have come up in relation to all of that.
Yeah, thanks, Stephanie. Yeah, I'd encourage everybody to put some questions up if you do have any, which aren't there at the moment. But I've probably got two quick ones if I could, Stephanie. So, being a part of design of hospitals, there's obviously a substantial construction cost, and everybody values floor space and facilities really highly. And with so some of these breakout spaces being less clinically orientated and a little bit more difficult to get the tangibility of the spaces, how are some of the ways of getting places like this more respected, I suppose, and seen as more critical in health facility layouts and that style of thing?
Yeah, that's a great question, and that's really what our research is doing. By talking to parents and observing what they do in these spaces, we start to see that the parent lounges that are a little bit larger and a little bit more thoughtfully designed are incredibly well utilised.
Yep.
And parents were spending 7, 8, 9 hours in there a day. It's a long time. And we're finding that there was a level of social support that came from that really enhanced their experience of being in that hospital. And knowing that allows us to justify the inclusion of these kinds of spaces or push for their inclusion, because research tells us that there is a valuable contribution to having a space like this, that it's worth the extra few square meters in terms of supporting that family.
Yeah. Thank you so much. I see Kerry Rouse has put a question up, and Kerry's asked whether the facilities are provided in units where single bedrooms are the predominant facility.
Yeah, great question. The answer is yes. So most of the wards where we were doing these observations did have single patient bedrooms. So there is a level of privacy already for the family. The value really of the parent lounge was being able to make food, which was not possible really in a patient's bedroom. Sometimes little things like having a conversation, making a phone call that they didn't want their child to overhear, and there was very little space to do that otherwise, aside from just found space in a corridor, which is sometimes just not appropriate. And being able to interact with other families, so other parents, being able to share knowledge, social support, those sorts of things. And for some, just a break from the patient bedroom was such a reprieve, and really bolstered them in terms of their resilience and their mental health.
Yep. Okay. Thanks so much. I think that's the end of our questions for this section, Stephanie. So we might move on to the next part of your presentation if we could.
Absolutely. All right. So the last area that I wanted to cover in our discussion today is on how to design supportive waiting areas. So our survey told us that there are certainly things and places within the hospital that can take your mind off being in hospital. The answer here was a resounding yes. There are things in this hospital that take our mind off the fact that it's a hospital. So as a first port of call, that was good for us to know. Then we asked, well, what are some of the features that take your mind off being in hospital? We see things like spaces to hang out with other children your age, outdoor playgrounds and gardens, places to play inside as well. technology that you might have bought from home, so iPads, iPhones. The interactive atrium screens, so those big screens that I showed in that photograph earlier, they were also useful. Different drawings, paintings and photographs on the walls, those large interactive sculptures that we saw, and certainly the animal attractions. So these are some of the features that are really useful in a hospital environment to make it feel less hospital-like for the children and their families. The parents and caregivers, they also suggested many of these things, and we see very few parents saying none of these spaces take my mind off being in hospital. But up here we see cafes and gardens are really, really useful, animal attractions, and certainly playgrounds as well. So both patients and parents are recognising that there are many aspects of these environments that are supportive and help to take their mind off the fact that it is a very clinical environment. Now, in terms of the waiting area design, we see some real differences between some of the spaces that we observed. So in terms, we compared here in this graph waiting areas to atrium. So we saw a lot more people just sitting, staring and looking around the room in a waiting area than what we did in any of the atriums. Now, to us, this implies that it's not an exciting space. They're not interacting with anyone or anything. They're just sitting and staring. We see a lot less playing in a waiting area than what we do in an atrium. Now, playing for us suggests that there's interaction, that there's things going on, that there's that this might be a more supportive activity in a paediatric hospital. We also see more conversing with others, so this is between families. We see more of that in the atrium spaces, and more conversing within families as well. Now, for us, we felt that it's wonderful that we're seeing this in an atrium space, but we also need to see that in a waiting area, because sometimes the anticipation of an appointment or a surgery or anything of that nature is quite a stressful experience. And in waiting areas, being just sitting and ruminating on what might happen next is not often a supportive place to be. So how can we be designing these waiting areas in a more supportive way? We started to think about this. So these are some of the differences that you'll see. So at the Royal Children's Hospital, the atrium space has this quite large interactive sculpture. Now we see a lot of families and children gathering around this, playing on it, climbing on it, and then we see parents talking to each other. It's a lot more interaction and a feeling that there's things going on. We also see these sort of activity areas which were quite helpful in waiting areas to encourage more interaction, and we hypothesized to help parents and children take their mind off their coming appointment or surgery or whatever they're in the hospital for that day. Now, in terms of these are from the Monash Children's Hospital, so the interactive sculptures and the interactive screen were very important features for promoting that dialogue and discussion both within families and between families. So we're seeing a lot of these kinds of features within these very public atrium areas, and not often as much within the waiting areas themselves. So we hypothesized that is why we're seeing less of the conversation and more of the other activities like staring into space, which we don't imagine is as helpful in a waiting experience. So we talked to some children about this. One explains that spaces which facilitate opportunities for play, these are definitely my happy place. Providing such opportunities will cheer me up in any mood that I'm in. It's nice to know that I can go there, I can play Mario Kart and not have to think about anything else. I don't have to think about how family or how my mum is doing, even though I will. And spaces that facilitate play are the go-to place where you would want your kid to go for happiness. They really get your mind off things. So here we're talking about play, and we're starting to understand the therapeutic value of play for these children. Therefore, we need to start to understand how we can facilitate play in multiple of the hospital, not just in a particular activity space. How can we make it a part of the hospital experience to really increase that therapeutic outcomes and experiences? They also talked about the interactive screens as being really helpful and encouraging more interaction within and between families. So again, we know that these features make a difference to those inpatient environments. Now, the staff that we spoke to also talked about the role of play in the waiting area as really setting the foundation for an effective interaction and a care experience. Now, one staff member said to us, if things have gone well from the start, you know you're set up for a good shift, and you know you're starting on the best possible feet with the family and the child. So play definitely benefits, as long as it continues through the whole journey. If we can have that play concept throughout the whole journey, it makes a big difference. So for us architecturally, we need to start to think about how can we facilitate play across multiple areas in the hospital. What is the journey, the patient experience? What spaces do they proceed through? And how can we bring play and experience into those different stages of that journey? And it's not just about the children. The parents are less stressed when the children are less stressed. If we can provide comfortable, supportive waiting spaces for the parents as well, and that has flow-on effects to the children. Those massive benefits, as the staff member said, to the children. So some of the design strategies that came up in our research to facilitate the positive effects of play. Now these include spaces for children to lie down, providing comfortable chairs, not beanbags. These are really difficult for some children with accessibility needs. Providing accessible play equipment for a variety of different children. Having play equipment with tactile elements and storage for a range of materials in different spaces. Interactive screens, these are fantastic. Easy to make a part of many spaces. Facilitating layouts that incorporate spacious circulation between seating and suitable areas to park prams. We saw that that was quite a difficulty for many families. Activity zones like painting and arts and crafts, we saw integrated into many waiting areas, and they were really supportive, really helpful. Gave the parents a bit of a reprieve because their children were being entertained, and gave the children something fun and exciting to do. Oops, sorry, my lights have just gone off. All right. Sorry about that. And so these waiting area activities were really important. Being able to see those activities and what was going on was also useful for children who maybe didn't want to participate, but they could at least watch and feel like a part of it. Providing space for parents to play and interact with their children. Some spaces were so small that was really difficult to do. And providing space for children to play that might accommodate various medical equipment that some children would have with them. So those are the strategies that we've come to, and that was the 3 areas of key findings that I've brought to share with you all today. And I certainly welcome any questions on anything that I've picked up so far today.
So thanks again, Stephanie. We have actually got quite a few questions, and I realised that they were coming in on the chat rather than questions. So we'll fire a few of those off. So question from Nick Presswood there, wanting to know whether the finding of the studies are publicly available for reference for any future public or private health facilities?
That's a great question. So we have just been sort of bringing together all of our findings. We have done some publications, which perhaps I can share with you, Russell. We are also looking to publish a book of designing for wellbeing within paediatric care settings, which, keep an eye out for that. I'm also happy to have a bit more of a dialogue with people. I'm happy to share my email address, and we can have a bit more of a chat about some of the key findings from the research, if that is helpful to any of the participants today.
Yep, thank you. Nick's also put another question up, and he sort of asked whether you're aware of any government incentives or any funding for public or private facilities that, I suppose, promoting facilities like we've talked about today.
Look, I'm not aware of any funding specifically, but I think our clients are becoming a lot more aware of the relationships between architectural design and wellbeing, and there is more of an understanding of how architectural design can be more than just a housing of service, that it's actually a therapeutic experience or a contributor to a therapeutic experience, and therefore our design responses need to be across some of this contemporary research and bringing in these ideas. So, whilst I don't think there's any funding, well, no, I'm not aware of any funding specifically for this, our clients are becoming more educated in this area, and it's also often up to us on the design side in terms of engineering, architecture, policy, planning. How can we be encouraging this kind of design approach?
Yep. Okay, thank you for that. So Harm Hollander has put a question up, and Harm's question is, being a parent in a previous family room scenario, needing a separate space from unsociable or disruptive parents, and wanting to know whether that was something that you actually found coming through in any of your research.
Yeah, that's actually a really great question. It's come up in a slightly different form. So there was a family that we ended up speaking to who they had a patient bedroom that was right next door to another family, and they found that the acoustical separation between these rooms was perhaps not sufficient, and they could hear the conversations that were happening next door. The child was quite loud often, and they were not only living through their own hospital experience, but through the noise and the crying and other aspects like that. They were really living through the procedures of the girl next door and the family next door. So though not, they were sort of inadvertently able to overhear everything, that really did disrupt their own experience, and they found that they really needed escape to get away from that. And so you make a great point that sometimes we need space away from other families that are on the ward, and that can really affect your experience and your child's experience of the hospital environment. That's where there's the value in things like the parent lounges, but also courtyards or sometimes roof decks, balconies, spaces like that you can go and visit. The Starlight Room, the children's activity space. Yep. These become valuable in those kinds of circumstances.
Yeah, thank you for that response. So I think we've just got one final question at this stage, and it's come back from Kerry Rouse. So Kerry said in New South Wales they're currently in the planning phase of provisioning 2 new paediatric facilities. So she's sort of wondering whether there'd be access to some of the data and information which would be really beneficial to the planners of those projects, and also to push for change or variations to the Australian Health Facility Guidelines. So yeah, if Kerry could have access to some of that, either directly or group, that would be magic. Yeah.
Great, thanks for your questions, Kerry, and wonderful great projects to be involved in, certainly. So our data itself, the raw data we cannot share. Our ethics is quite strict on that, but I can share the details of some of the publications that we've put out already, and I'm more than happy to have a conversation with you about some of our findings and what might be useful to you in your project work. So perhaps we can share, I think my email address is already part of the webinar for this, but
yep.
happy to make that available and carry on the conversation.
Yep. Okay. Well, I think we're getting very, very close to being able to close it out. Just before we do that, I'll just share one of Mark Winter's comments that he actually put on the chat. And I think it pretty much you'll be supported by everybody in the webinar. But Mark said you're doing an amazing job in uppercase, and thank you for the work you're doing in helping to create a better environment for our health facilities. So big pat on the back and well done. I think everybody's got great value out of the presentation today, Stephanie. So
oh, thank you for that feedback. That's really lovely, and I'm sure everyone here is perhaps as passionate as me about the therapeutic value of architecture and how it can really shape experiences. And it's in healthcare particularly, we have a vulnerable group that are here. They're stressed, they're unwell, their families are stressed and unwell, and what can we be doing to support them in their time of need? So it's really important research, and it's wonderful to have such like-minded individuals here today. So thanks for your feedback. That's wonderful.
Beautiful, thank you. So yeah, without that, we might draw a close. Again, I'd just like to thank you wholeheartedly for the preparation and the delivery of your presentation today. It's been top shelf. Thank you so much for that. So just to keep everybody in the loop, the webinar has been recorded. It takes us a little bit of time to bring that together, but over the next couple of days, we'll share a video with a link to that for you to revisit any of the webinar that you may want to, or to share it with other industry associates and that sort of stuff. And for any other future webinars on similar theme or other, if anybody would like to keep in touch, just follow us on LinkedIn, DMA Engineers, and that'll keep you updated on that. So yeah, on the back of that, I'll just final thank you to Stephanie and call our webinar over. So thanks so much, everybody.
Thank you. Thanks everyone for coming.
Bye-bye.